Hello everyone, my name is Natasha Groden. I'm the Marketing Coordinator here at Berman Hopkins. I'd like to welcome you to today's healthcare webinar. Today on our panel we have Rob from Likes Insurance who will be joining us and talk about the healthcare update. Rob, you want to say hello to everybody?
Hello everybody, welcome.
And we also have Heather McDonough here from Berman Hopkins.
Hi, thanks for joining us today.
All right, so I want to let everybody know that during the presentation, if you have any questions, please type them into the questions pane, and we will answer them at the end of each section. Here's our agenda. We're going to first go over the actual healthcare update. That's going to be done by Rob. Talk about the 6 concepts to know, the framework, penalties for individuals, employers, and strategy. And then we're going to move on to the tax implications of healthcare reform. So at this time, I'm going to go ahead and turn it over to Rob.
Thank you, Tasha. Let's see if we can get this showing. Do you all see it yet?
We do, if you'll just go full screen.
Working on it.
I say Rob is joining us from Tampa, and we're over here in Melbourne, so we're so thankful to have him here today.
Okay, there we go. All right, before I get started, let's try to make this go. Tasha, how do I get the screen sharing off of my screen?
You should be able to hit the orange arrow, and that will take the GoToMeeting menu away.
All right, good. Bear with me just a second. I'm trying to get the screen to go forward, and it's not.
Did you click back onto the actual presentation, and you should be able to then click it with your arrow keys?
I thought I did. Bear with me. Does it say? Can you see my screen right now?
We sure can.
Tasha? Does it say leave webinar or end webinar for all?
Don't click that button.
I won't. But
there we go. I think it's now moving for us.
All right. Good. All right. So before we get started, I like to do a little sort of an analogy or a comparison of the whole healthcare reform process, which we've been going through for really 2 years now. And I don't know if you're familiar with the Kubler-Ross 5 stages of grief, but many of us are. Some people call it the 5 stages of death. But the first stage, and everybody really has to go through this process, is denial. And if you remember when the law was first passed, I think that's what a lot of people experienced. They were sort of like, no way, they didn't really pass this thing. I mean, Scott Crawford won the Massachusetts election, and it just didn't seem possible. So a lot of people started there, and I think a lot of people are still there. The second stage is anger. And I remember a lot of people, they're like, those bums, how could they do this? It's going to break the country. They didn't even read it. Then the third stage is bargaining. And there was a lot of talk about, John Roberts and the Supreme Court was going to throw this out and find it unconstitutional. And then if that didn't happen, certainly the election would change things and it'd be repealed, or, all 50 states would get a waiver. And so we went through all this bargaining. Then the fourth stage was depression. And I think a lot of people felt that way, that it was going to, break the country or create a lot of work for HR people, or businesses were going to have to pay penalties, and people really had a hard time getting over it. But the fifth stage is acceptance. And I can tell you that my team, right after the Supreme Court ruling, we decided, let's get to acceptance, let's learn this thing, let's run the numbers, and figure out how we can help our clients. And the first thing I would suggest to everybody is just get to acceptance. Let's, this is the law of the land, and let's figure out how we're gonna make it work for us. So this webinar is not about all the compliance tasks. I mean, we've all been to webinars and seminars on this for the last couple of years. That's not what this is about. This is going to be about really the math and the strategy. There were very few regulations released during the campaign season, but since then we've had well over 1,000 pages of regulations starting on December 28th, and we will touch on some of those things. All right, so the 6 concepts to know, and this webinar sort of builds. First you have to have an understanding of how the exchanges work. Then you need to understand what modified rating means and what it means to you as business people and individuals. And then we'll spend some time on premium credits and subsidies. I'm not on taxes because we have an expert in the room in Heather, so I'll let her handle that. We do have to address penalties and affordable coverage, what the concept of affordable coverage means. And then we can, once we have those 5 things together, we can talk about how we can be strategic. All right, so let's start with the exchanges. The exchanges will be available for individuals and small businesses, and small businesses can buy coverage if they're under 50 employees through 2015, and then after that under 100 employees. Picture Orbitz or Travelocity for health insurance. So when you go online to buy an airplane ticket, you see lots of different offerings from lots of different airlines, but they look the same, so it's easy to compare. And that's the way it'll be in the exchange. You'll have metal levels of coverage, so the cheapest ones would be bronze, the most expensive would be platinum. They all have to cover essential health benefits, and essential health benefits is yet to be completely defined, but it includes things like emergency care, hospital prescriptions, mental health, pediatric services. You all know that it covers preventive care, and this is going to be kind of a political issue to determine what exactly essential health benefits will be. Ideally, or originally, it was thought that all 50 states would either have an exchange or team up to make exchanges. Only about 17 states have committed to making their own exchange, so there will be a federal exchange that people like maybe Floridians will default to. And there'll be annual enrollment periods. So the first annual enrollment period for coverage starting January 1st of 2014 will start October 7th. And when you go online to apply for coverage, there are no health questions at all. So no longer will you be asked about your blood pressure or your weight, nothing like that. And so your rates will not be dependent in any way on your health. All the coverage will be guaranteed issue, which means nobody can be denied, and there are no pre-existing condition limitations. So this is the first time in history that you've been able to buy insurance for something after you get sick. It's almost like being able to buy flood insurance after there's a hurricane in the Gulf. It's unique, and nobody really knows what it's going to do to rates. And the big picture on the exchanges was the idea was that you'd have competition. All the major carriers would be in the exchanges competing on price, just like instead of United Airlines, it's United Healthcare. And size. There's a sort of a feeling that if you're part of a big pool of employees, that your rates would be low. Unfortunately, that's not really the case. If you're part of a group of young, healthy people, your rates are low. And we don't really know what the effect of adverse selection will do, because if you've got people that can wait until they get sick to buy coverage, we just don't know if people will wait until they get sick to buy coverage. So that's a little about exchanges. The next concept is modified rating. So in the individual and exchange markets and in the small group markets, so up to 50 employees through 2015, the only factors that can be considered in rating is location. So obviously, presumably rates will be less expensive in Tallahassee than Miami. Family status, so if you have a lot of people, it's more expensive. Tobacco use, and carriers can load rates 50% for tobacco use. That's pretty big. And then the third thing, and this is critical, is age, and it can only be a 3-to-1 rate spread. So if you look at this little chart, right now you can have a spread. Let's say a 24-year-old could get a great plan for $100. But a 59-year-old, it might cost closer to $600 if they're healthy. But if you can only have a 3-to-1 rate spread, either the premium for the 59-year-old has to be cut in half, or the premium for the 24-year-old has to double. Now, I don't see rates being cut in half for a 59-year-old. So there's concern as to what this is going to do to premiums for young people. Okay, now subsidies. This is sort of the crux of the law. And this is why it's called the Affordable Care Act. So the way you read this chart is on the left-hand side, you've got the federal poverty level. So for instance, at 200% of the federal poverty level, that would be for a family of 4 making about $44,000 a year. And according to the law, that family can't spend more than 6.3% of their household income on family health insurance. And the plan designs themselves are even enhanced depending on income. So for this $44,000 a year family of 4, they couldn't spend more than 6.3% of their household income on health insurance, and that's a very rich plan. We'll talk about what actuarial values mean in a minute. Notice here that under 133% of the federal poverty level will be Medicaid. It's essentially free coverage, and that's assuming Florida goes along with like Arizona and some of the other states who have agreed to accept the expanded Medicaid funding from the federal government. So let's look at an example. Here's a situation. A 39-year-old family, a 39-year-old has a family of 4 with $55,000 of household income. So they're at 250% of the federal poverty level. So right now, let's say it's 2014, and they've got a group plan where for family coverage, they pay $800 a month, which wouldn't be unusual. And they're in a cafeteria plan, so they use pre-tax dollars, so they only really spend $616. And that plan has an actuarial value, and I'll show examples of these in a little bit, of 70%. If they go on the exchange, the actual premium might be $1,200 a month, but at that level, they can't spend more than 8% of their household income, so they only pay $366 a month for full family coverage, which is, if you look at where you work today, or what you provide your employees today, that's very generous, and that's affordable. And that would be for a richer plan than they have today. So this family saves $250 a month, $3,000 a year for a better plan. And by the way, take a look at the difference between $1,200 and $366. That annually is something around $10,000 that in terms of federal subsidies for this family starting in 2014. Now take a look at an example with an employee making a little less money. So maybe this family, one of the spouses lost their job. So now it's $33,000 of family income, 150% of the federal poverty level. Same, where they were now, same $800, a month contribution, $616 after tax. But in exchange premium is still $1,200 and more than 4% of their household income, which is $110 a month for full family coverage. For a much richer plan, 94%. So as you can imagine, these families, particularly this family, if they can go into an exchange, if they can leave the group plan, say $500 for a richer plan, they are going to do it. And I think they're going to want to do it if they're educated as to how the exchange works. And by the way, the subsidy here is about $13,000 a year for, in terms of a federal subsidy for this family, which is not that unusual family starting next year. Now, normally in my presentation, I go into the tax, but I'm not going to do that because Heather's going to cover that later. All right, so now let's look at a very different example. Here we've got a 54-year-old making $70,000. So here's like maybe a senior manager at your company, and he covers his spouse, or she covers her spouse, and the household income is $95,000. So they're at 462% of the federal poverty level. So they get no subsidy. And let's say where they work now, they're paying $500 a month for employee and spouse. They're a cafeteria plan, so they use pre-tax dollars, so it only costs them $375 for an 80% plan. Now to get a 70% plan in the exchange, it's going to be about $1,200 at that age. But there's no way to buy, that I know of, to buy health insurance in an exchange with pre-tax dollars. So to have $1,200, this person really has to earn about $1,600, and that's for a 70% plan. So that's about $1,200 more per month that this employee would pay for less coverage. That's almost $15,000 a year. So this person would take a $15,000 pay cut if the employer dropped the group plan. So for that reason, some other ones I'll show you later, I don't think there's going to be a lot of wholesale dropping of coverage, regardless of the size of the employer. All right, let's talk about penalties for individuals. So the law also says that all individuals have to provide themselves essential health benefits. And if they don't, the penalty in the first year, which is 2014, is $95 or 1% of income. So let's say that $50,000 a year person, that penalty is $500. So we make it $25,000, the penalty is $250. The penalty tops out at 2.5% of income in 2016. So again, so a $50,000 a year family, that's $1,250, pretty much always less than what the premium would be, other than for highly subsidized low-income individuals. And as far as I can tell, it really only applies, the penalties are only applied to tax filers, because the only way the IRS collects the penalty, or I guess it's actually a tax, is through the filing process. It comes out of person's refund. Okay, penalties for employers. And this is effective on plan years on or after January 1st or 14th. So if you have a calendar year plan year, it's effective for you on January 1. And one of the things that came out in the December 28th regs is that since it doesn't apply to, if somebody has a 7-1 plan year, they get 6 months, delay. But it said you can't change your plan year now because it goes by whatever your plan year was, effect 12/27/12. So you can't change it retroactively. So small employers, which are under 50 employees, there really aren't any penalties or requirements. They will be subject to modified community rating, and we'll talk about what that will mean to them. Their employees are eligible to go into the exchanges, and they get subsidies in the exchange if their employer plan is considered unaffordable. And we're going to spend some time in a little bit about what unaffordable means. Large employers, they are subject to 2 main kinds of penalties. One is the no coverage penalty, which is if they don't offer a plan. And then the second kind of penalty is the unaffordable coverage penalty, which we'll talk about and I'll show examples of in just a second. And then for all employers, there are discrimination penalties, and they are really big. It's $100 per day per employee. And these penalties have been delayed for a couple of years now. But what this is it's always been legal to discriminate between classes of employees with health insurance. So you could say, we're going to have a plan that covers the salaried people, but it doesn't cover the hourly people. Or a lot of law firms have had plans that said, we're going to cover the partners and their families, but we're only going to cover the employees for single coverage only. That's always been legal. And when you think about some, hospitality or restaurants, they've done this forever. So they cover the owners and maybe the managers and maybe the chefs, but the wait staff or maybe the housekeeping isn't covered. Well, that was always legal. It's no longer legal, and the penalties could be huge. If you have 200 employees and 20 are covered, and you say you have 180 not covered, that's $18,000 per day, up to $500,000. So a lot of employers are going to have to fix that. So what is a large employer? Well, a large employer would average at least 50 full-time employees during the preceding calendar year. And there is some transitional relief for 2014, which we'll talk about in a little bit. So how do we determine the number of full-time employees for purposes of who is a large employer? Well, certainly you take your full-time employees. If you know who they are, you know who they are. 30 hours. A lot of plans require 35 hours for health insurance, but in 2014, according to the law, it's 30 hours. And then you basically aggregate your part-timers. So you take the total number of part-time hours worked in a month and divide it by 120. So let's, in an example, let's say you had 30 full-timers, and you had 30 part-timers, each working 20 hours a week. That's 86 per month. So times 30 is 2,580 hours divided by 120. That'd be 21 full-time equivalents. When you add that to the 30 normal full-timers, that would be 51 employees for purposes of a large employer. And in this example, this company would be a large employer. Hours include all paid and unpaid, or all paid hours, so vacation, holidays, jury duty, sick leave, all those hours are included. And even unpaid hours if worked. And the example in the IRS Q&A is an adjunct professor who's paid for 15 hours of class time, but also has 15 hours of class prep or paper grading or something like that. That would be 30 hours, and they would all count. There's an exception for seasonal employees working less than 120 days. And as in anything, and Heather can elaborate on this, for sole proprietors, partners, 2% owners of sub-S corporations aren't included. They're not considered employees. Foreign employees are not considered as well. So it's only work performed in the United States. And at this point, leased employees don't count either. And controlled group rules apply, which means that if you have several companies owned by the same ownership, they're all aggregated for purposes of large employer status. Just having separate federal employee or federal identification numbers doesn't mean anything. It's ownership. So what are the penalties? Okay, first is if an employer fails to offer essential health benefits to at least 95% of the employees, and that was a concession. It was originally to all employees, but it's hard to figure out all employees. So to 95% of the employees, and at least one employee could get subsidized coverage through an exchange, then the penalty is $2,000 for all but 30 full-time employees. So if you have 200 employees, then if you don't offer essential health benefits to 95% of the employees, then you'd pay a penalty of 170 times $2,000, which was $340,000 for nothing. And the penalties begin on plan anniversaries on or after January 1st of 14. The second kind of penalty, I think this is the penalty that's going to be more prevalent, is the unaffordable coverage penalty. So here's the example of an employer does not offer, or he does offer essential health benefits for their employees, but some employee goes into the exchange and gets a subsidy. If that happens, each of those employees that go into the exchange, the penalty is $3,000, or actually $250 per month. The employee can only get a subsidy in the exchange if the coverage is determined to be unaffordable. And for it to be unaffordable, the coverage has to have less than a 60% actuarial value, and I'll show you some examples in a second, or it has to cost the employee more than 9.5% of their household income. And dependent coverage and contributions are never tested for these purposes, so it's just about single coverage. And it's really just about the lowest cost plan and the employee contribution for that low cost plan. Penalties for unaffordable coverage can't exceed what the penalty would have been for the no coverage. And this is a really short little line here, but there's a lot said here. It says the exchanges adjudicate and bill. So think about what the exchanges have to do. Presumably, you'd go online to apply for coverage, and the exchange would ask you a bunch of questions like, where do you work? Is your plan affordable? It would have to go to the IRS and find out what your household income is, and then it would adjudicate. And presumably, it would probably have asked all the employers in the area what their benefits are and what their payroll deductions are, because they have to adjudicate eligibility for the subsidy. They get to decide who's eligible and who's not. And if somebody is eligible for a subsidy, they have to essentially bill the federal government subsidy. They've got to bill the employee for their share. They've got to bill the employer for the $250 a month penalty. They've got to pay the Cigna, United, or Aetna bill, because they're going to get paid in full. So the job that the exchanges has is huge. It's a very complicated undertaking that I don't think we can underestimate. All right, so what unaffordable coverage, what does it mean? Well, here's just an example. Somebody making $20,000 a year, the monthly deduction of $158 or less would be, and as you can see, as you go up in incomes, an affordable contribution, I don't think it's going to be hard to keep your plan affordable in terms of monthly deductions. The U.S. average is around 110, so I don't think that's a big issue. Actuarial values. This is a complete oversimplification of how actuarial values are determined, but it's a good example. So let's say somebody had $5,000, in essential health expenses. They go to the hospital, they have outpatient surgery or something like that, and the deductible is $2,000. So the plan pays $3,000, which is 60% of $5,000. So if this was typical, that would be a plan with a 60% actuarial value. The next example is the same $5,000, but this plan is a $1,000 deductible. So the benefit is $4,000. That's 80%. So that would be an 80% actuarial value plan. And here are a couple examples of 60% actuarial value plans. So the one on the left, $500 deductible, 80/20 to $5,000. Then the plan pays 100%. The one on the right is a $2,000 deductible, 80/20 to $5,000. But this plan has a prescription drug plan and $30 copay for prescription for primary care physicians. So that is, I think those are pretty good plans, and those are 60%. So this is the low end of the spectrum in the Affordable Care Act. So if you wanted to make the plan unaffordable so that people could go into the exchanges, it wouldn't be hard to design a plan that would meet that goal. All right, so I'm not going to spend a lot of time on here, but for full-time employees, for the purposes of assessing penalties are different. For purposes of assessing penalties, you don't ever have to worry about part-timers. They're not aggregated in any way. So full-time employees expected to work 30 hours after 90 days. The trick is sometimes you don't know when you hire somebody how many hours they're going to work. So the regulations have given us a path to determine who is and who isn't, and essentially you create a standard measuring period. It could be 6 to 12 months, and during that period you measure everybody's hours. And then you get an administrative period up to 90 days to do the analysis of who is full-time and who is not, and then you create a stability period where you enforce that. So essentially you might take a 6-month period from April to October of 2013, and then take a couple months at the end of the year to determine who was and who wasn't part-time, and that's their status for 2014 during the stability period. All right, so let's get to the strategy. We've gone through really the exchanges, the subsidies, the penalties, what's affordable coverage, what's unaffordable coverage. So how do we use this? How do we determine a strategy that's right for us? Well, let's first assess the current effect of low-income employees on employer contribution strategy. I would submit to you, and I've been doing this for 30 years, that we spend all our time trying to sort of appease or take care of the lower-income single employee. We're always trying to design a plan that is rich enough and inexpensive enough that this person will buy the plan for lots of reasons, not the least of which is we care about these people. We want them to have coverage. We like them. We want them happy. Also, we've got participation requirements where the insurance company says we need 75% of your eligible employees covered, or we could cancel this contract. So that's where we spend our time. What's the result? Well, their families, they're losers. I mean, almost none of these people can afford coverage for their family. The single high-income person is a big winner. This plan is designed for this guy, but this guy benefits greatly, and they can generally afford coverage for their family. It's not easy, but it's possible. But what if we looked at this very different and we said, what if everybody say make at 200% of the federal poverty level or less? What if we make it possible, or maybe even encourage them to go into the exchanges? What happens? Well, these single people here, they're big winners. The families are huge winners. Remember that example earlier about somebody making $44,000 a year could get full health insurance coverage for, I forget, was it $230 a month or something like that? Huge winners. Now we're designing a plan for somebody making maybe between $45,000 and $75,000. Totally different requirements here. And it's entirely possible that for this person, maybe a consumer-driven, high-deductible plan with an HSA really could work, because they don't work very well with low-income people. Low-income people don't want to buy those. They don't want to buy a plan that has money come out of their paycheck every month that they can't use in the form of a copayment that same month. Still got an issue with the families of these people, and the high-income people are still the winners. So, to determine strategy, what would you want to know? I think first of all you'd want to know, and if this is in the data, we have to we have to really analyze your data, or somebody does. Who could go to the exchange? I mean, who do you have right now who could be eligible for a subsidy? Who should? We'd also want to take the Medicaid people out because they don't generate penalties and they sort of come off the table. And then should they be allowed to go to the exchange by making the coverage unaffordable? Or maybe just for them, maybe for people at a certain level of the federal poverty level. Should they be encouraged? And how would you encourage them? What would be the cost of the penalties? We'd have to know that. What would be an affordable plan for those who don't go to the exchange? Could you actually take some money out of the plan? Would that be possible? Maybe we go consumerism all the way. Now, I think you'd also want to know who were the big winners and who were the losers. You do take some money out of the plan, and how could we make them whole? We want to look at participation, because I think it's entirely possible that participation could improve. If you can tell the insurance company that these people who aren't on the plan are in the exchange, well, they have coverage elsewhere. I think you have to look at how could hours be reduced, because once you get to 30 hours, that's consequential. And then I think there's a question as to whether or not access to exchange subsidies could be a recruiting advantage, and could it even in some industries be a requirement? I mean, if you saw some of those examples and understand how affordable that coverage could be, would it be possible to have lower income people work for you if you denied them access to that by keeping your plan affordable? I don't know the answer to that necessarily, but we all have to wrestle with it. So let me show an example here of, this is just a typical sort of illustration. The example here is a manufacturing organization with 200 employees. 150 of them work over 35 hours, and 180 work over 30 hours. And currently, or in 2013, 150 people are on the plan. The employer pays a net after tax, because premiums are deductible, $3,500 per employee, so that's what the employer is kicking in. So a net $525,000 a year to cover 150 people. So what changes? So 2014 comes along. Now, 30 hours becomes eligible. So now there were 150 eligible. Now there are 180. And in this example, 20 of those 30 people decided to sign up for the plan because it's a very affordable plan. And so now the premium is $595,000. And so this employer takes it on the chin for $70,000 bucks, but at least 20 more people got coverage. What if they just dropped the plan, which they could do? So they've got 180 people over 30 hours minus 30. So 150 penalties at $2,000 each. So they would have $300,000. That's not deductible, so it's comparable. So this company saves $225,000, but nobody has any medical coverage at all. And think about the repercussions of those senior managers going into the exchange with after-tax dollars. So what if they create a strategy and decide to optimize the law? What if we really try to figure this thing out and benefit by it? Well, the first thing that this employer would do is they'd say, of these 30 people that work between 30 and 35 hours, can we keep any of them under 30? And in this example, they said, yeah, 10 of those 30, we could just tell the managers, keep those folks to 30. And then in this example, they actually did a benefit reduction. Either they maybe raised the deductible or dropped some copays or raised the payroll deduction, but they got 40 people eligible for subsidies in the exchange. And then because they approached them or educated them, 35 of these people actually went into the exchange, and 25 of them came from the group. So 10 came from no coverage, and 25 came from the group. So now you've got penalties. 35 people at $3,000 or $105,000, which now you only have 125 on the plan. And see, that's $3,000 now because they took some money out of the plan. It was $3,500. They took $500 out of the plan, made it a little less affordable. So now the total is $480,000 for 160 people. And so now they're actually having better benefits for a lot of people. They save $45,000, and they have 10 more people covered. So if they optimize it, they're covering more people for less. So what would they do with that $45,000? Well, they could take it to the bottom line. They could, or they could, make people whole. Or they might, if you don't mind me going back to it, they might try to address this box here. Those folks that really are having a hard time to afford family in that income level. What are we learning here? Well, strategic modeling. There are a few things that are going to be happening. One is the concept of leveraging the subsidies, and that's going to be most effective with employers that have a lot of low-income people. And I say low-income, really, we're talking under $50,000. It's really not low, but it's relative. And a lot of them are covered now, because in that situation, you're just taking people from the group plan to the subsidy, so there's really, the penalties really aren't more than what the employer was paying. And by the way, this strategy works regardless of size. It doesn't matter if you have 200 employees or 10 employees. If you've got some low-income people who could benefit from the exchanges, it might be important to make that possible. Another strategy may be to avoid penalties. And that would be more important in the situation where you've got a lot of lower paid people but aren't covered by a plan now. So you might not want to educate them about their opportunities in the exchange. You might even make your plan affordable so they couldn't go in the exchange. But if you do that, it doesn't address the participation problems, and it certainly doesn't address the recruiting issue if it becomes important to have access to exchanges for recruiting and retention. And then also we're going to be talking about managing headcounts and or hours. Of course, it depends on the business model. But I think going forward, the day that you're full-time employees, or the day that your employee, establishes, an average of 30 hours, those thresholds become kind of important. and we're going to have to manage around that. I think it's entirely possible that job sharing could become very common. You could have people that work 20 hours a week at McDonald's and 20 hours a week at the Burger King, and they're working 40 hours, but they're not a full-time employee for anybody. And then partial leasing or staffing could play a role. If you had 40 employees, maybe you figure out a way to lease your next 12 or you use a staffing company. And I don't think we're going to have time for it, but about the legislative intent around leasing. So what are the next steps? I got to tell you, I think the first step is to get to acceptance. I don't think this is going away. So let's face it. You know, if you know me, you know I'm passionate about planning. More employers should have a plan around their benefits than do, but in this area, you just have to have a plan. And you know, it sort of starts with gathering data. You got to determine, you know, full-time employees and whether or not you're a large employer. So you need to start thinking about establishing measurement periods and policies, and you need to document everything because someday, you get a bill from an exchange for $250 for somebody who you are quite sure is part-time, but they've told the exchange that they're full-time. So now you have to have a policy and show the documentation, you know, show the sample measurement period and the stability period that this person is not full-time. And then start modeling. I mean, until you start running some numbers, you're not going to know what is the strategy for you. And without modeling, I don't know how you're going to be able to budget and fine-tune your plans. And then consider employee communications. I mean, this is a new kind of communication. There are obviously required notifications. There was one in March that was supposed to go out by all employers to start notifying their employees of the existence of exchanges, but that has been postponed, which is kind of curious. Well, I guess not very surprising. And then the question is, who would you reach out to? You know, if you thought there were some people that should be going to the exchange, they're on your plan now. I mean, how would you do that? I mean, this is one of the first employee communications that is almost all around income. So how would you, when would you do that? How can you help these people? And, you know, where else can you get help? And these are the things that, you know, we need to start building into our plan. And I think this number might be off by 7, but I think we have about 314 days until this starts. So that's a lot of stuff, but I'd like to open it up for questions, and I'm going to look in here and see if we have any.
Hey, Rob, this is Heather.
Hey, Heather.
When you say that the communication is postponed, do you know how long that's postponed for?
Nope, do not know.
Okay.
Great question.
I know there's a question out there regarding, oh, sorry.
I can't read the question here.
There's a question out there regarding whether employees that are leased through a PEO is considered leased employees.
Yeah, great question. And that leads to a question, yeah, if they're leased through a PEO, that is a leased employee. And if you are a small employer, joining a large PEO would not at this point make you subject to large employer penalties. And what happened there was Senator Bill Nelson was very adamant that that shouldn't be the intent of the legislation. He made it, he had a question asked during the time when the legislation was being batted back and forth between the Senate and the House, and they asked Senators Sebakis and Grassley, the Democrat and the Republican, if a small employer joined a PEO, would they be subject to large employer penalties? And they both said no, they didn't think that was the intent of the legislation. But there's nothing in the law that says that that wouldn't be the case. And all other laws, it's been the opposite. So like when a small employer joins a PEO, all of a sudden they're subject to COBRA and FMLA. So in every other area, it has brought them up to large employer status. It hasn't in leasing so far, and that's why.
I think the question goes the other way as well. If a company has 100 employees, but they're leasing them through a PEO,
okay,
they're still considered to be their employees, are they not?
They only be considered a large employer. So you can't escape large employer status by joining a PEO. You might be able to do it if you have, like the example I gave earlier, you have 45 employees, and your next 10 are leased. You might have my employees. They're somebody else's employees. I only have 5 employees. That, I think, is going to be tested, but at this point, I think that's possible. And I did one of these with a group of lawyers.
Basically.
Basically, so too. I'm sorry, Heather?
Yeah, I think it all reverts back to the common law test of. I think it all reverts back to the common law test of employees on who has control over how that person does their job and who they're reporting to.
That's what it specifically says in the Q&A.
Rob, can you see the other questions that are posted?
I can't see them.
There's a number of them now.
Can somebody just read them because I can't see them?
If you pull out the question, you may have to. Yeah. A couple people have asked about getting copies of the presentation slides, and we will have those in the presentation posted to our website.
Great.
Shortly after the presentation. Another one, can an employee who has military coverage opt out?
Okay, so yeah, because they would have to have coverage, and if they have military coverage, they're not going to go in the exchange and get a subsidy, so it doesn't drive a penalty. They're not going to pay a penalty because they do have essential health benefits. Yeah, sure, I think the answer is yes.
Okay. Next one, what are the rules for a company that has less than 50 employees? What are they subject to in all this?
All right. Well, all the stuff that we already went through, where the dependents, children through age 26, no lifetime or annual maximums, all that stuff we've already gone through. So you probably lived that, and that's not changing. There is no requirement to provide essential health benefits. There are no coverage or unaffordable coverage penalties. An under 50 employee group, their employees can get subsidies in the exchange if the plan is considered unaffordable. So there was not a lot of downside to the under 50 employee group. They don't have pay or play penalties, which is what the large employers have. That's the essential difference.
Okay. The next question, Rob, are churches and nonprofits included in these requirements?
Yes.
And let's see, will small employers be able to offer HRAs to employees so that they can go to the exchange with tax-free money?
I think the answer to that is no. And this just came out very recently. The question really was, could you have standalone HRAs? An HRA is a medical plan. Medical plans have to conform to those no lifetime or annual amounts. So, well, HRAs do have lifetime or annual maximums. So the IRS said you can have HRAs if they are integrated into a medical plan. So if it was like you have a $2,000 deductible and you put $1,000 in the HRA, but you have the major medical plan in addition to it that doesn't have lifetime or annual maximums. But if you want to do a standalone HRA, like just for purposes of getting tax advantages in the exchanges, it specifically says no. So now I've heard other people have interpretations that are pretty aggressive, calling them self-insured medical plans, but the answer is no. Heather, do you have any other opinion on that?
And lastly, no, actually, I apologize. I was moving on to reading the next questions here.
No problem. No problem.
Can an individual who is employed opt out altogether from an exchange and an employer-offered plan?
Okay, so an individual is employed.
So basically, I guess that's saying they would have no
coverage at all. Well, then they pay.
It sounds like they're saying whether no coverage at all.
Well, if you have no coverage at all, you pay a penalty or a tax of between 1% and 2.5% of your income, assuming you're filing a tax and could be identified to either your tax goes up or your refund goes down.
And let's see, are penalties after tax? So basically,
No.
are the penalties deductible?
They are not
Because
deductible.
they are considered to be taxes, which is part of the Supreme Court decision that had come down.
I defer to you.
And I think that's all the questions that have been posted so far, but if anybody has any more, feel free to post those up and we'll make sure we cover them again before we check out here today.
Hey, thanks, Heather.
Rob, thank you so much. I'm going to go ahead and I'm going to go ahead and take over from here
Great.
and talk about some tax implications and reporting implications of the Health Reform Act. And some of this will apply to you as employers and some of it will not, but wanted to make sure we brought several things to everybody's attention. Okay, the first one is the small employer health insurance tax credit, and this has actually been around since 2010. For 2010 through 2013, you can get up to a 35% credit. That credit is 25% for not-for-profits. For tax years beginning after 2013, there's going to be a credit up to 50% of your premiums, but you're going to be purchasing through the state exchanges to get that credit. This is for qualified small employers, so that consists of sole proprietorships, partnerships, and non-publicly traded corporations who have average annual gross receipts less than $50 million for the prior 3-year period. Generally, to get this credit, you've got to have less than 25 full-time equivalent employees, and Rob was just kind of walking through how you are determining full-time equivalents. There are some exceptions to that, back to the seasonal employees and the leased employees with the ramifications that we've already discussed. Also, to get this credit, you're going to have average full-time equivalent annual wages of less than $50,000 per employee. The credit is based on the applicable percentage of employer-provided health insurance. The employer must be paying at least 50% of the premiums to be eligible for the credit. And as I mentioned, it's 25% in 2010 through 2013 for nonprofits, tax-exempt entities, and it is a 35% credit for the 2014 and beyond period. Let's see. Go ahead and skip to the next one. The maximum credit can only be obtained for employers that have 10 or fewer full-time equivalents and average wages for them of $25,000 or less per employee. So you'll see that the credit's going to phase out as you increase your number of employees from 10 to 25, and will phase out as you increase your average wages from 25 to 50. So the 25 employees and the 50,000 is the last dollars you're going to get of this credit. So to maximize it, you'd have 10 or fewer and 25,000 or less in wages. Now, using these credits, you can deduct these against your regular taxable income and your AMT. When you do take the credit, you lose the deduction for those premiums. So there will be an add back on your tax return for the deduction you were taking previously, and then you'll get the credit. But the credit is much more beneficial because it's a dollar-for-dollar reduction off of your tax bill. And for those of you that are pass-through entities, the credit does pass through to the individuals on the K-1, just as your R&D and other types of credits do. Any unused credit, so if you're not able to use it in the current year because maybe you're in a loss situation, the credit can be carried back 1 year. Sorry, that shouldn't say on, that should say 1, and carried forward 20 years. And if you have missed taking the credit and are eligible to for 2010 or 2011, you can file amended returns to go back and claim the credit. Now, this was one of the revenue raisers of the Health Care Act, and this is an excise tax on indoor tanning services. So for those of you that have tanning services, you probably are already in the process of collecting and remitting these. And if you are a user of tanning services, you are probably paying an additional 10% excise tax when you go in and purchase these tanning services. Basically, it's sort of equivalent to a sales tax in that they're supposed to be collecting it and remitting it. And if anybody's in this business and wants to talk about it, just feel free to get in touch with us directly on this one, because it will not apply to many of you. The Form W-2 reporting was supposed to have gone into place for the 2012 tax year, and this is in regards to reporting the aggregate cost of employer-sponsored health coverage on the Forms W-2. They did come out with a relief provision so that employers that had filed fewer than 250 W-2s in the preceding tax year, or calendar year rather, were not required to report this on the 2012 W-2s. But this is, unless they come out with another relief provision, this is going to be required for the 2013 W-2s, and this will report both the cost of the insurance that's paid by the employee as well as that's paid by the employer. And on both sides, it's regardless of whether it's pre-tax or after-tax. And Rob, correct me if you know otherwise, but it seems to me that this whole provision is just for them to start accumulating data on the overall cost of insurance, so they can try and measure the savings or the additional costs that happen as the Healthcare Reform Act gets into full swing.
That's my understanding.
Beginning in 2013, there's going to be fewer deductions for medical expenses. Up through 2012, the threshold for itemized deductions of your qualified medical expenses was 7.5% of your adjusted gross income, and this is on the personal returns. As of 1/1/13, the threshold now has increased to 10% of your adjusted gross income. Now, if the taxpayer or the spouse is 65 or older, these provisions do not take effect until 2017. So there's a little grandfathering going in for them. Another revenue raiser that they've implemented is an excise tax on sales of certain medical devices. So if you are a manufacturer or a producer or importer of an FDA-listed medical device that's used for humans, there is a 2.3% excise tax that is now in effect that's applicable to the sales price of this device. And we do have several clients that are falling into this, and there's some registration processes that have to be gone through, and you already would be collecting on this excise tax at this point, probably from your vendors. Not everybody's, or sorry, from your customers. Not everybody's going to pass this on. Some people may take the hit to the bottom line, but generally what we're seeing is that the prices are being increased, and they're actually a lot of times showing it as a separate line item on their invoicing so that their customers are aware that this was not just an overall pricing increase that they're implementing, but really is as a direct result of this excise tax. And with this, there's quarterly, I think that might be on the next one, there's quarterly reporting. Go ahead and jump to the next one, on Form 720. And there are a few exceptions to this, which basically have to do with those things that can be purchased by the general public at retail, which includes eyeglasses, contact lenses, and hearing aids. Those things will not be subject to this excise tax, but pretty much every other kind of medical device out there will be. Lastly, and for those of you who sat in on our income tax presentation a couple weeks ago, this may be a little repeat for you, but we wanted to make sure we included it here because this is one of the heavy-duty revenue raisers to help pay for this health care reform, and that's in the form of Medicare surtaxes. There's two components to this, which both became effective the first of this year. The first is a 0.9% Medicare surtax on compensation. So if you're single, it's on your compensation over $200,000, or if you're head of household, it's the same. If you're a married filing joint taxpayer, when your joint compensation between you and your spouse reaches over $250,000, you will have this additional surtax on everything over and above that. MFS is for married filing separately, so it basically just takes the joint piece and cuts it right in half. The second piece of this is a 3.8% net investment surtax. This one is not based on your compensation. This one is based on your modified adjusted gross income on your tax return. So once that reaches $250,000 for married filing joint, the additional income, your income on your investment income is going to be taxed with an additional 3.8% tax rate. And you can see the other income thresholds there. We'll talk about these some more. What is your net investment income? It's your interests, dividends, annuities, royalties, rents, cap gains. There are some exceptions for the capital gains if you're selling stock of a business that you are actively involved in. And then also passive business activities are considered net investment income. And we'll talk about that a little bit more in a minute as well. This slide has to do with the compensation component. You could get in a couple situations where if you work for a company and you make $250,000, your employer is going to know on that last $50,000 that they have to start collecting and remitting the additional 0.9% Medicare surtax. However, if you're in a situation where you make $200,000, your spouse makes another $100,000, you're now over the $250,000 threshold, so you're going to owe some additional Medicare surtax to the tune of $450, and that will not have been withheld from your pay because individually neither of you were subject to it, but jointly you are. So that's going to end up hitting on the personal returns as being an additional tax due. The same thing could happen if you're a single individual but have a couple different jobs over the course of the year where each employer individually you're not hitting the threshold, the $200,000 threshold, and so they're not collecting and remitting, and again you're getting into a situation where now you've got $50,000 that has not been withheld that you owe it at the end of the tax year, and that'll be on your personal return. If you know you're going to be in one of those situations, you could change the withholdings requested on your Form W-4 and turn that into your human resources folks, your payroll people at your office. Another thing you could do if you know you're going to have a pretty hefty hit there is to change your quarterly estimated payments. But if anybody has any questions about that, the dollars are not huge, but it's just going to be something unexpected. And as estimates are calculated for future years, that may not have come into play in the planning for that. We talked about active versus passive on the net investment income. So if you are actively involved in a business, the income from that business is not going to be subject to the Medicare surtax on net investment income. This is the 3.8% surtax. If it's passive to you, it will be subject to that surtax. And here you can see some of the definitions of what causes you to be actively involved. A lot of times you're meeting an hours test, but there's also situations where you're not going to meet the 500 hours. However, you may be the only person involved in that activity, and so you may be the only one who could qualify for it, and because nobody else is performing services within that company, you may be declared as active strictly from a lower hours threshold participation. A couple issues come up in regards to partnership interests, and you'll see this for LLCs as well that are reporting as partnerships. If you're a limited partner in a partnership, you're going to be subject to the surtax, but you're not subject to self-employment tax generally. On the flip side, if you're determined to be general partner, which basically is implying that you're active in the business, you are subject to self-employment tax on the income of the business, but you're not subject to the surtax. So you kind of get into a situation where you're going to get hit one way or the other, and the surtax on the net investment income is 3.8%. Your self-employment taxes are 2.9%, what they've been all along, and another 0.9% surtax that's new this year, and that comes up to an additional 3.8% as well. So it may be that you're hit one way or the other, and but anybody who's in that boat, we ought to talk to and plan, because there may be some other ways around this. One of the main ones being converting to S-Corp status. If you're an LLC operating as a partnership, which has been very typical in recent years, it's allowed a lot of flexibility in terms of the ownership group and the way you can handle distributions and so forth. But S corporations, if you're active in the business, you're not going to be subject to this net investment income on your profits, only on any wages that you're taking, and again, that's going to be at that lower 0.9% rate. So S corporations are sort of coming back in vogue as a result of these surtaxes, and are definitely a strong planning entity right now, assuming that you can meet all the other requirements of S Corp status. And that is it from my side of things. Let's visit back to whether we have some new questions here. Rob, are you still there?
Yes, I am.
Okay. Looks like there's one additional question that got posted in regards to the insurance side, and that was regarding whether new employees on a 90-day probationary period, do they have to be offered guess, benefits as an employer from day one?
No, you can still have a 90-day waiting period, but that's the maximum.
Okay, great. Natasha, do you see any more? Oh, here we go. Okay, one more long one here for you, Rob. We have 8 employees. Most have high premiums, where 5 over $850 a month. You know what, Cheryl? I'm going to have you, Rob, take this one offline with you because it's got some pretty strong details that I want him to be able to address directly.
Okay. I'd be glad to do that.
One last one. Okay, we'll make sure we get that to you. One last one here. I was under the understanding that the 3.8% surtax is on the lower of net investment income, or MAGI, and that is correct. So you got to meet the adjusted gross income threshold to even become subject to this, and then the surtax will be on the lower of the two. And I think that's it for us. Natasha, you want to wrap us up here?
I'd like to thank everybody for joining us. I'd like to thank Rob for signing in and telling us so much about the healthcare update. Here's some information for Rob if you would like to email him directly. Cheryl, we will pass along your question specifically to Rob, and he will be in contact with you. We'd like to thank everybody for coming. There are a few survey questions at the end of the webinar when you're signing out. We would greatly appreciate your feedback. And I think that's it for today. So thank you so much for joining us, and have a wonderful, wonderful Valentine's Day tomorrow.
Thanks, everybody.